Welcome to my channel. For successful conception, both husband and wife need to maintain good health and live together. The husband and wife should live together and have intercourse 2 to 3 times a week. If even after 1 year of trying conception does not occur, then it is necessary for you to seek advice from an infertility specialist. The doctor will conduct some tests to determine whether both husband and wife are healthy enough to conceive or why they are unable to conceive. A sister asked me which tests should be done if conception does not occur. So, in this video I will discuss about this topic in detail inshallah. So, let's get started. Before that, it is important to know how conception occurs and importance of health our certain reproductive organs for conception. The fusion of woman eggs and man's sperm during intercourse leads to the creation of an embryo. Conception does not only depend on the fusion of the egg and sperm, there are other factors involved. Women have 2 ovaries in their reproductive system. Each month, at a specific time during the menstrual cycle, an egg is released from the ovary. The release of the egg from the ovary is called ovulation. The released eggs travel through the fallopian tube waiting for the sperm. If intercourse occurs during this time, the sperm meets the egg in the fallopian tube and fertilization takes place. The fertilized egg then implants itself in the endometrium. Endometrium means the lining of the uterus. This process is called implantation and it results in conception. However, if there is a problem with ovulation, fertilization or implantation, it can lead to difficulties in conceiving. Even if there is problem with your husband's sperm, it can lead to difficulties in conceiving. Now, discuss about which tests should be done if conception does not occur. The first requirement for successful conception is that your eggs have a normal shape and quality. If you have regular periods, it can be assumed that your eggs have normal quality. However, if you are overweight or over the age of 35, it can negatively impact the quality of your eggs. To assess the quality of your eggs, the following tests are recommended. Number 1. Blood test for hemoglobin. The hemoglobin levels in the blood should be within the normal range of 12 to 16 mg per deciliter. If the hemoglobin level is low, it can affect the quality of your eggs. Number 2. Diabetes test. To determine why conception is not occurring, a diabetes test should be conducted. Even you have diabetes, it can affect the quality of your eggs and hinder the conception. Number 3. Abdominal ultrasonography. Since the eggs are stored in the ovaries, and abdominal ultrasound is performed to check the condition of the ovary. It helps identify the presence of cysts in the ovaries, which are commonly associated with polycystic ovarian syndrome or PCOS. Additionally, an ultrasound can also detect the presence of fibroid or polyps in the uterus. Number 4. Hormone test. Ovulation is essential for conception. It is very important for the eggs to reach the correct size for ovulation. Various hormones are necessary for the proper growth of the egg, such as thyroid stimulating hormone or TSH, luteinizing hormone or LH, estrogen, progesterone, and others. If these hormones are either too low or too high, it can cause problem with conception. Additionally, if the high level of the hormone called prolactin is high in the body, it can also lead to difficulties in conceiving. Therefore, it is necessary to check the level of hormones such as serum prolactin, THS, T3, T4, LH, and others in the blood. If the hormone levels are not normal, it can hinder the process of getting pregnant. Number 5. TBS or transvaginal ultrasonography test. We know that ovulation is important for conception in women. During a specific time of menstrual cycle, the egg released from the ovary. For the egg to be released, the size of the follicle containing the egg should be 18 mm or large. By performing a transvaginal sonography or TBS test on the 12 to 14 day of menstrual cycle, we can determine the size of the follicle and assess the possibility of ovulation. After ovulation, when the sperm and eggs unite, the resulting embryo implants itself in the endometrium. It's called implantation. For the implantation, the endometrial thickness should be between 8 to 15 mm. If the endometrial thickness is less than 8 mm, it may be hinder the conception. It is mentioned that the endometrial thickness can vary at different times of menstrual cycle. Therefore, it depends on when you are conducting the test during your cycle. Hence, performing a TBS test can help measure endometrial thickness and follicle size. A TBS test is done to check for any tumor or polyp inside the uterus. If there is a problem or tumor in the uterus, it can also affect the process of conception. Number 6. Hysterosalpingography or HSG. Apart from regular menstruation and everything appearing normal but conception is not occur, another test that may be necessary is HSG or hysterosalpingography. It is a type of X-ray. After ovulation, the sperm wait in the fallopian tube for the egg. If the fallopian tube is blocked, the sperm and egg cannot meet and conception does not happen. Therefore, it is appropriate to undergo an HSG test to determine if there is tubal blockage. Number 7. BDRL test. If there is an infection in the uterus or a sexual transmitted disease and infection in the cervix, it can also cause problem with conception. Therefore, both partners should undergo a BDRL test to check if they have any sexual transmitted infection. Another significant factors in not getting pregnant is male infertility. Number 8. Semen analysis test. The second primary requirement for conception is normal sperm in males. A man needs around 20 to 200 million sperm per milliliter of semen, and more than 60% of the sperm should have normal shape and mortality. If the quantity of sperm in the semen is low or the sperm mortality is poor, it can lead to difficulties in conceiving. Men should have a semen analysis test to see if their sperm are normal. In many cases, it's seen that due to male problems, pregnancy does not occur, yet all the blame is given to women. Therefore, both husband and wife need to healthy to conceive a baby. If your period is regular, your weight is normal, you exercise regularly, the husband and wife stay together, and you have intercourse every 2 to 3 days in a week, then there is an 80% chance of getting pregnant within a year. To conceive, the husband and wife stay together and have intercourse according to the ovulation day. Note that you don't have to do all the tests mentioned here. Based on your condition, the doctor may conduct a physical examination and some additional tests or even reduce some tests. It depends on your specific problem. So, even after staying together for a year, if you don't have a baby, you must consult an infertility specialist. They will provide you with the correct guidelines, inshallah. Once your problem is diagnosed and you receive treatment, you will likely succeed quickly, inshallah. I have just given you a brief idea about which tests should be performed and why. No more today. Hope this video was helpful for you. If you find the video helpful, do not forget to share with your friends. And please subscribe to my channel to get health advice, health awareness and reproductive health related all the video. And remember to become a member of our family. Stay with us healthy and safely. Thank you for watching this video.